program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
What up, y'all? We're the Doctors, yo. With the stars of the rhyme, we're about to float.
It's a fun look at a very serious topic, when to go to the emergency room or when urgent care will do. These local doctors broke out into song to explain the important differences. Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. We'll bring you more of that doctor rap a little later in the show, but first, we've all been there. We're sick or in pain, but should you go to the emergency room? Today, we're talking about when to go to urgent care or when to head straight to the ER, or if you could just wait it out at home. Today, our experts answering your questions are Dr. Linwood Watson, the medical director of Rex Express Care, and Dr. Colleen Casey, a Rex Hospital emergency room physician. To call us here at Rex on Call, just dial the number on your screen. In Wake County, 919-744-3876, and outside of Wake County, toll-free, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us your questions to rexoncall@rexhealth.com. You can even find us on Twitter. Send us a message at Rex Healthcare. Use the hashtag RexOnCall. Did you guys know that the average price of an emergency room visit will cost a patient more than $2,000 and that the average urgent care bill is about $150? When you're in pain, it may be hard to know where to go. Now meet a local man who made the right choice.
Larry Dickerson, owner of Walls Jewelers in Raleigh, admits he doesn't go to the doctor until he really needs to, like when he woke up a few months ago in extreme pain.
One Sunday morning I woke up and I had the shingles and it hit me in my right eye. I had excruciating pain, I mean really excruciating pain. It was shooting right out the top of my head.
He came to the Rex Express Care in Nightdale.
As soon as I walked in the door, the nurse realized I'd had a problem. She said, "You have the shingles?" I said, "I do." So she went and got me a compress, hot compress to put on there.
Dr. Linwood Watson was able to see him right away.
There are certain acute conditions that patients can't wait for. A good example is shingles because it often is very painful. It's very disconcerting to patients.
Open nights and weekends, Express Care Centers offer labs, x-rays, and procedures without the wait or expense of the ER. The emergency room is for true emergencies, like if you're experiencing chest pains or having signs of a stroke. The Rex Hospital Emergency Department, with its new helipad, is a destination for patients from smaller hospitals around eastern North Carolina that need emergency heart or surgical care.
Emergency rooms are very busy, very hectic places. And the thing about an emergency room is that they are wonderful if you are having a life-threatening emergency. All through this country, we are blessed with emergency rooms that if you are near death, within 15 to 20 minutes, they will have you back to life. Now, while your ear hurts, you will be pressed aside for that person.
And a severe ear infection is exactly what brought Larry back to Rex Express Care recently.
And I'd probably had this earache for a week, but it just got to the point where it hit me, and when it would hit, my head would jerk. It was so bad.
Although the pain made it feel like an emergency, Larry knew that that wasn't the best option for him.
It would have been an option had I not had urgent care this close to me, and this was so much more convenient for me, and you don't have that waiting period you have when you go to the emergency room.
Joining us now are Drs. Linwood Watson and Colleen Casey. Now, the ER, it is very important to know the difference. When should you go to the ER?
I think there's certain conditions that you definitely want to always go to the emergency department. Anytime you're experiencing chest pain or shortness of breath, any stroke-like symptoms, numbness, tingling, weakness on one side of the body, those severe abdominal pain, those could be signs and symptoms of some very serious or life-threatening medical conditions, and you always want to call 911 and go to the emergency department for those.
Yeah, and so when should you call 911, or when should you try to drive yourself or have someone drive you?
With any of those symptoms that I just talked about, you certainly want to call 911. You also don't want to be driving and put yourself at risk or put anyone else at risk. So if anytime you're experiencing dizziness, you also want to call 911. Anytime there's a potential that you could decompensate on the way, you don't want someone to drive you, you want to call for an ambulance. In particular, the paramedics and first responders have medical knowledge as well as the ability to treat on site if need be, and could be life-saving for you.
Okay, both urgent care and emergency room, what should you bring with you?
Definitely on the urgent care side. ID often helps. Insurance card if you have it, certainly. The other thing to be sure to bring is all of your medicines. And a sub part of that people often forget is to be sure to bring all of your medicines, your vitamins, your over-the-counter supplements, maybe even something that you were taking from somebody else. We need the full picture to make an accurate assessment in the urgent care. So that is very important. In addition, in particular, often it's highly recommended for the elderly to bring someone with you. That can help in a busy urgent care or certainly a busy ER. It's hard when you're alone and sick to stay abreast of things and to stay attuned to what's going on. So it helps to have an advocate there.
Yeah, I would also add you certainly want to always have your physician's name, at least know who that person is, as well as a list of any medical allergies that you have, or drug allergies, excuse me. Mm-hmm.
And there are a lot of healthy people that don't really see their physician that often, quite honestly, and may just go to an urgent care a few times a year, or use the ER as that, and maybe abuse that. But talk to me a little bit about the important role of having a general practitioner, a general physician in your life.
One thing I can definitely attest to is that, urgent care offers a lot of good things. Convenient hours, convenient access in terms of location. I can tell you that one thing that we try to do though, and one thing that keeps us efficient and will give you better healthcare results, is for chronic diseases to don't attempt to manage those in the urgent care. Big three, of course: diabetes, high blood pressure, cholesterol. Think about it this way: if this is a long-term problem, if it's been going on for over a month, there probably is not going to be usually an acute or a quick fix for it. It needs some continuity. It needs some following, some monitoring, ideally by one person who has a global view of the situation. And that's where a primary care physician really can assist you and keep you on track.
I think also having a primary care physician also can do a lot of prevention. And so much of what I see in the emergency department could be prevented either with good health habits, with not smoking, and so there's a lot of primary care work that can be done by your regular physician in order to try to keep you healthy and keep you out of the emergency department.
I do think there's just a portion of the population that just hasn't had time or access to figure out, hasn't found a physician, quite honestly.
I think a lot of times, especially being in the local area, there's a lot of people moving into the area, is urgent care, or sometimes even the ER, is your first introduction to the local healthcare system. But often all of our physicians and staff, if there is a chronic problem or something that's better handled, we'll try to steer you in the right direction.
Okay.
In addition, certainly Rex has the ability to help you find a primary care physician on their website. They have the ability to do that.
Absolutely.
And they can hook you up with someone in the community with where you live that can help facilitate that.
Awesome. Great advice, guys. Coming up, we'll hear more from Dr. Watson on his rapping debut and how this tune has helped educate a wide audience. We're back after the break. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions on when to go to urgent care or when to head straight to the emergency room. If you have questions for our experts, call in now. In Wake County, call 919-744-3876. Outside of Wake County, 877-277-6252, or email us your questions to rexoncall@rexhealth.com. Since this is such an important topic, Rex decided to create a fun and memorable video to help educate people about the appropriate medical conditions that should be treated at an urgent care versus an emergency room. Take a peek of this out-of-the-box approach.
We're not too far, so when you get in your car, you sometimes should use us instead of the ER.
Oh no, Well, you broke your arm, relax. We got an X-ray and we'll fix you up fast. A spot about yo, I know it's a fright, but come in. We'll treat you.
So one of our guests today, you probably noticed, is Dr. Watson, our star rapper. So what have your patients said? What have people said about seeing your debut as a rapper?
Several patients have commented, family also, but the good thing is that it's always good to get your message across with humor. And I always appreciate a chuckle, you know, especially, and sometimes you have serious topics. So I appreciate the chuckle, and I figure if all else fails, I can embarrass my daughters one day.
That's great, that's great. Okay, now on to questions. Linda has a kidney stone. She was released from the hospital, but it still hasn't passed yet, and she's in a lot of pain. Should she go to the ER or urgent care?
That's probably something more to first call the urologist or whoever took care of her and see what kind of recommendations or follow-up instructions they had given her. But anything for diagnostic testing for that or treating that may be more helpful from the emergency department standpoint rather than the urgent care.
Yeah. Okay. Kenneth has had a swollen knee and is in pain, wants to know if urgent care is appropriate for that.
That would be appropriate. We work very hard with our diagnostics on site. If we need an X-ray or something like that, along the same lines, if it is something more emergent or serious, we try to set you up either via the ER or specialist if needed.
Brenda has a sinus infection. Should she go to urgent care or try to wait it out?
Big thing with sinus infections that we see. We certainly can see that in urgent care. That's a bread and butter topic. We see a lot of sinus issues. But I tell people the biggest thing is to give the snots and congestion, give it some time. 7 to 10 days always goes a long ways in terms of differentiating, is it viral or is it bacterial?
Okay.
A lot of sinus infections won't require antibiotics.
Yes.
Okay, and if you go too soon, maybe you're giving antibiotics and you don't need it. Okay. Frances, 66 years old, pain under her right rib radiates to her back. She doesn't like to go to the doctor. Okay.
That can be a lot of different things, and that's something that she certainly needs to seek medical attention for, most likely in the emergency department. Although that there are some very easy things that could be, like a pulled muscle or a broken rib, there can be some more serious causes, pneumonia, pulmonary embolism, a blood clot in your lung. So there can be some very serious things that could be and needs to be addressed.
Okay. Wow, we have possibly a gallstone or on her right side. Where should she go? She's in a lot of pain. This is Regina, possibly a gallstone. Where should she go for help?
That's probably also the emergency department.
And the big thing with that situation is, you have a large amount of pain, very severe pain, best addressed in the ER. That's a good back of the napkin rule. So yes, definitely the ER for there.
In addition for that, if it is gallstones or needs to have a surgery, then certainly you want to have that capability on site.
That is correct.
Yeah. Joanne was urged to go to the ER for falling frequently. Should she call 911 every time she falls?
Not necessarily. I think if what's precipitating the fall is chest pain, dizziness, shortness of breath, or if she has falls where she's not sure at all what has happened, then those might need a 911 call and or coming to the emergency department. If it's just a matter of balance and I fall more frequently as I've become older and I'm less balanced, then that could be either addressed in the urgent care or certainly by her primary care physician.
Okay. That brings up one thing, is that it's very important, and sometimes it even approaches near the level of arguments. If you go to an urgent care and they suggest, or they call 911, or they feel as if you need to go to the emergency room, please go.
Yeah.
Oftentimes we hit a lot of resistance, but after an assessment, if we feel like that condition warrants, we encourage people to heed it.
Yeah, and you guys communicate with the ER, right?
Absolutely.
They know you're coming if you've gone to a Rex urgent care. They know to expect you.
And all of our urgent cares, we call it in to the emergency room, regardless which emergency room that is.
And that's a physician-to-physician call, or provider-to-provider call, so that we can have good communication amongst ourselves as to what they were concerned about, so that we know what to address as well.
You know what's coming. Okay.
Yes.
Coming up, we'll answer more of your questions in Wake County. Call 919-744-3876. Outside of Wake County, call us toll-free, 877-277-6252. We'll be back after the break to answer more of your questions. This is Rex on Call. Welcome back to Rex on Call, here live on WRAL. To reach us here at Rex on Call today, you can call 919-744-3876 in Wake County. Outside of Wake County, call still free, 877-277-6252. More of your questions. We've got a good stack here. Now, Phyllis from Zebulon says she's had 3 strokes. She has a headache and intermittent numbness on her left side. When should she call 911? She's alone.
She needs to seek medical attention immediately.
Call now, Phyllis. Call now.
Yes. And that's a perfect example of someone who also needs to call 911. She has the potential to decompensate or get worse. In particular with strokes, we worry about the timing. As soon as you have any stroke-like symptoms, you want to seek medical attention at the nearest facility immediately. Call 911. With stroke, there's potential treatment that is time-sensitive, and so the earliest that you're seeing, the better.
Yeah.
So she needs to call right away.
Yeah, thanks for calling us, but please call 911 right now.
Ambulances are made for this.
Yes, yeah, absolutely. You're not bothering anybody by doing this. Harold from Clinton, neuropathy, his neuropathy, wants to know if that's an urgent care visit or a primary care visit.
Definitely, Harold, with neuropathy, primary care. There's a lot of causative factors that need to be taken into account. You need a large global view to assess and figure out the source there.
Okay. Someone's heard you can take Tamiflu within the first 24 hours of flu symptoms. How do I know if it's flu or something else?
I would tell you, a good back-of-the-napkin rule, just in the practical world, if you feel like you've been hit by a bus,
that's the flu.
It's probably the flu. Seek help, in particular if you have higher risk conditions, like if you're asthma, the very young, less than 5, or the very elderly, and definitely pregnant women.
Okay.
With flu symptoms, it comes on suddenly, and the flu facts, F is for feverish, and then A for aches, C for
Let's see.
Cough.
Cough.
And then T for
temperature.
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 Okay.
Yes.
Okay. So yeah, definitely. And is that something you should wait out if you feel like it's been a couple days, or should you go see the doctor if you feel you have the flu?
You know, people do live through the flu. One thing that worries all physicians is if you're so weak that you're having poor fluid intake. In all of those risk areas that we mentioned, the big thing is that you become dehydrated and then you rapidly decompensate. Okay. So if you're laying on the couch and you can't even take in fluids, please seek help.
Okay.
Yeah.
And again, for flu, that's something that you can prevent. So everyone go get your flu shot. Make sure that that's something you can do it to protect yourself.
Okay. Here are the top 10 reasons why people go to the emergency room. Ready for this? Most of these can be treated at an urgent care, I do believe. Top 10 reasons for ER visits: sprains and strains, open wounds of the extremities, pregnancy, headache, back problems. There's another one, there we go. Upper respiratory infections, urinary tract infection, kidney stone, intestinal infection, and chest pains. So I think a lot of those could be, so tell me on that list, I'm going to quiz you now, Dr. Watson, what could be urgent, what can go to the urgent care?
Definitely. Sprains and strains, coughs, the congestions, the urinary tract infections, basic lacerations, boils, abscesses, all of those from that list could definitely go to the urgent care. I'm not sure if that list was in frequency, but I wish number 10, chest pain, would have been number 1 reason to go to the emergency room.
Right.
Yes.
Yeah, chest pain needs to be assessed in the emergency department. Another rule of thumb is if something has come on suddenly, that sometimes can be an indication that there might be a more serious cause. Severe abdominal pain comes to the emergency department. Pregnancy was up there, and any kind of pregnant and bleeding, that needs to come to the emergency department, or well, your primary doctor as well.
Okay.
And it helps a lot of people. I mentioned cuts and lacerations. That's a common topic in urgent care. One good rule I tell people is that if you apply firm direct pressure for 15 minutes, and then you check it and it's still oozing or bleeding, probably needs to be seen by, seek medical attention. That you're not going to go wrong generally with that rule.
That is great to know.
Now the hard part is waiting 15 minutes. I'm sure there's an app that'll help people do that, but most people want to check after 3 minutes.
Yeah.
But give it a firm direct pressure, 15 minutes. If it stops bleeding, no more oozing, you're probably good, and can at least seek care tomorrow. But otherwise, you want to seek care urgently.
Is that the same rule of thumb for adults as children? Because I feel like the kids get it a lot more.
Generally, yes, assuming there was no other major trauma. You know, kids fall, they could lose consciousness, things like that. Then obviously, that's more than just a basic laceration. Yes.
Okay, great. We will have a final round of your questions after this break. This is Rex on Call. Welcome back to the show. This is Rex on Call. We're taking a final round of your questions right now. This question from Raleigh: had a sudden onset of a headache. Blood pressure is 173/150 with a blood pressure monitor, and checked a few minutes later. The headache left and the BP was fine. What causes this sudden headache, and is that something that he should go follow up on?
Yeah, it's definitely something that you need to have some follow-up on. One is that the blood pressure might not be well regulated. Some people do have spikes in their blood pressure, but that can lead to strokes. And so anytime that's associated with a severe headache, we worry is there potential bleeding. Any time that that's persistent or followed with other neurologic symptoms, numbness, tingling, weakness, confusion, inability to speak, loss of vision, that needs immediate attention.
Okay.
Back to a previous point, blood pressure management, best done by your primary care physician.
Okay. This is Wilma. She wants after a bout of constipation has started noticing blood in the stool. Is that something that she should go to the emergency room about or urgent care about?
You can start the assessment there for that in urgent care, but I will admit there is a decent chance, especially depending on your age, that you may end up needing the emergency room. But it definitely would need an assessment to go from there.
Yeah, an assessment in either place, and sometimes that can be quite serious, and sometimes that can be just a matter of straining from the constipation.
Okay. Anne has Crohn's disease and she's in constant pain. I know that can be painful, and she sometimes has to go to the ER. She feels as if that her condition, sometimes people view it as not serious enough for the ER. So give us some advice on where should she start her treatment when she's in really serious pain.
Well, certainly Crohn's disease is a difficult condition to treat, and she should really have one physician, her GI physician or a pain management physician, helping her manage her pain. That's not something where you want to be seeing several different providers for. So she certainly needs to start with that person. In the emergency department, we certainly try to see every patient as potentially life-threatening, and so we take everything serious, and our job is to weed out what is the most serious cause. We treat that person first, or excuse me, most serious potential sick patient, and treat that patient first.
Okay.
Definitely remember with pain medicines, you only want one cook in the kitchen.
Right.
Centralize them to your regular doctor or your pain management specialist. That's for your safety. We hear all the time about overdoses, and it's for society's safety.
Okay. Bernita hit her head on some ceramic tile. Should she go to the ER to get this checked out?
That's something that probably could be started certainly in an urgent care setting. If she had, loss of consciousness or persistent vomiting, that would be or confusion. Then that's the time to take that head bump and come to the ER. But otherwise, just to be kind of checked.
Right. Definitely worth a check. That check certainly could start in the urgent care, and then we could triage it from there. Is this something that could perhaps hint at a more sinister illness?
Okay. And I know the rules are always so different. And real quick, our last question the rules are different with kids. When should we be taking our kids to urgent care ER?
One thing with, as Dr. Casey mentioned earlier, as long as kids are eating and drinking, peeing and pooping, you're holding your own.
Yeah.
Generally you can kind of practice the 3 to 5 day rule with that.
Okay.
Maybe not every case, but the majority. But certainly if the child is lethargic, poor fluid intake in particular, that needs a medical assessment that can start in the urgent care.
And you can see kids starting at age 4 months,
yes,
right?
At our Express Care system, we see ages 4 months and up.
Okay.
Certainly, you can always start with a call to your primary care provider or your pediatrician, though, to point you in the right direction. Okay. And that can be done through the phone.
Okay. As always, consult with your physician about any health concerns. Thank you very much to our phone bank for taking calls. And there's the phone number for Rex Health Net, where you can find a physician. We'll hook you up. Thanks. Join us next time for Rex on Call.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.